And that's March 12th.
Yeah.
This March 12th.
Yeah, cafe. It's just gonna be a trial one, so I think if nothing else, just put it in.
You said it right away.
Well, they haven't finished it yet, but it must be eyes and,
Okay, then what?
you know.
Hold on there. I should have emailed to some email it back, say, hey, you can do that, print it out, color, let's get this done.
Two more things to click and then we're live.
Okay.
No, this is cool. It's so nice that we get to stream it like this and then it's accessible because so many people can't get out. So it does help.
I really expected to do so.
Oh, okay, good. Because I wasn't, I really, I didn't do the laugh on the dog. I think it's, I looked at it right now.
So we're live?
So this
Okay.
really well for me.
We're live. All right. So, good evening, everybody. My name is Dana Perderman. I am an anthropologist here at Southwestern Oregon Community College, and I'm a vet. And this presentation is really personal to me about the need for more suicide awareness, especially in our veterans community. So tonight we have Ariana Grant. I knew I was going to say that too. We have Ariana Reiseball, who has a master's degree in social work and has been doing suicide prevention training for the Veterans Affairs for the last 3 years. So without further ado, please give a warm welcome to Ariana Reiseball.
So today we're going to go over the VA SAVE training. And I just want to say thank you for your time tonight. I know you can be somewhere else, so I appreciate it. So who am I? As was just mentioned, I'm Ariana Reiseball, licensed clinical social worker. So I'm a coastal suicide prevention coordinator with the VA. And there's my contact information. So before we begin, suicide is an intense topic. If you need to take a break or step out, please do so. For an immediate resources, you can call the National Suicide Prevention Lifeline at 988. Service members and veterans press 1 to connect with the Veterans Crisis Line. There's also the text line and then the online chat. So overview. So the main purpose of this presentation is to help decrease suicide attempts and decrease death by suicides. So today we're going to go over objectives, facts about suicide, lethal means safety, common myths versus realities, the steps of VA SAVE, and resources. So objectives. By participating in this training, you will have a general understanding of the scope of veteran suicide within the United States. Know how to identify a veteran who may be at risk for suicide, and know what to do when you identify a veteran at risk. So take a moment to consider, what are your biggest questions around suicide and talking to people in crisis? So facts about suicide. So we're first going to look at it from a broad perspective. So the USA suicide statistics from 2021. And so all the USA suicide statistics are from the suicide statistics from AFSP, which is the American Foundation of Suicide Prevention. So suicide was the 11th leading cause of death. On average, there were 132 suicides per day, 48,183 Americans died by suicide, and there were an estimated 1.70 million suicide attempts. So USA suicide statistics continued. White males accounted for 69.68% of suicide deaths. Firearms accounted for 54.64% of all suicide deaths. and 94% of adults surveyed in the US think suicide can be prevented. So veteran suicide statistics from 2021, and all of this data is from the 2023 National Veteran Suicide Prevention Annual Report. So this is the most recent data that is available. So there were 6,392 veteran suicide deaths. Firearms were more commonly involved among veterans at 72.2% than non-veterans at 52.2%. Suicide was the 13th leading cause of death among veterans overall. So veteran suicide statistics continued. So the average number of veteran suicides per day was 17.5. So 6.7 of these veterans were recent VHA users. 10.8 of these were other veterans. So that's why it's so important that the VA is using a public health approach, is because there's a lot of veterans that are not stepping into the VA, and so we need to reach everybody. So the average number of veteran suicides per day. So in 2019, 17.8 veteran suicides. In 2020, there were 16.8, and then, as I said, in 2021, there were 17.5. So as you can see, the number did decrease in 2020, and then a slight increase in 2021. So then zooming in on the Roseburg VA catchment area, death by suicides. So in 2022, there were 10 veterans that died by suicide. In 2023, we had 3 veterans that died by suicide. So something did change. There was a big decrease, so something was working. And then in 2024, this calendar year, we've had 1 veteran die by suicide. So hopefully the number, the goal is to have 0 death by suicides. So hopefully we will continue to see a decrease in those numbers. So suicide is a national public health problem. Suicide is a national issue with rising rates of suicide in the general population. So for every 1 life lost to suicide, 135 others are exposed. So in the US, over 6 million people are exposed to suicide losses each year, a number that exceeds the population of Colorado. With 135 people being exposed to each suicide, anyone in your life, such as a neighbor, coworker, hairdresser, friend, gym instructor, bus driver, brother-in-law, former classmate, or coffee shop owner, may have been touched by suicide. Anyone you encounter may know someone who has died by suicide. So suicide is complex, and there isn't a single solution. That's why everything we do is led by these 3 principles. So suicide is preventable. Suicide prevention requires a public health approach, and everyone has a role to play. Suicide prevention is everyone's business. So suicide is a complex issue with no single cause. Suicide is often the result of a complex interaction of risk and protective factors at the individual, community, and societal levels. Risk factors are characteristics that are associated with an increased likelihood of suicidal behaviors. Protective factors can help offset risk factors. To prevent veteran suicide, we must maximize protective factors while minimizing risk factors at all levels throughout communities nationwide. So risk and protective factors. So common risk factors are having a prior suicide attempt, having mental health issues, engaging in substance abuse, having access to lethal means, experiencing a recent loss. So this can be a loss of a loved one, this can be a loss of a job, a loss of a home. So any type of loss can put you at risk. Having legal or financial challenges, having relationship issues, being unemployed, and being homeless. So common protective factors are having access to mental health care, having a sense of connectedness, so feeling like you're connected to other humans, not being isolated, having being social, having problem-solving skills, having a sense of spirituality, feeling like you have a mission or purpose. So there's a purpose for your life. That's a protective factor. Having physical health, being employed, and having a social and emotional well-being. So the goal is to minimize risk factors and to boost protective factors. So here are interventions to meet the needs of highly impacted groups that were identified from 2021 as having high suicide attempts. So American Indian, Alaska Native veterans. So there's grants serving tribal lands. They're increasing access to healthcare. So the VA provides funding to programs to increase needed access. There's special interventions for justice-involved veterans. So there's veteran justice outreach. So this is peer support specialist positions that the VA has created. Healthcare for reentry. So this is services for veterans in prison. There's veteran reentry search service. And this is partnership between criminal justice facilities and VA services. So there's special interventions for women. So services supporting MST survivors, addressing firearm suicide, and there's tailored suicide prevention interventions just for women. And then another specific intervention is for unhoused veterans. So the VA is providing grants, identifying at risk. So there's homeless safety planning in emergency departments. Can you go back really quick? And then the VA is also providing housing. So all of these interventions, you can find more information on these on the most recent Suicide Prevention Annual Report from 2023. So what's being done? So the VA is offering no-cost suicide prevention care. So there is the Compact Act, which came out last year. So veterans in acute suicidal crisis have been able to go to any VA or non-VA healthcare facility for emergency healthcare at no cost. So this covers 30 days of inpatient care and 90 days of outpatient care. So there is the new shortened crisis line. So the new number is 988. So over 1.3 million contacts have launched since it came out last year. And 12% increase from the previous year. So the average speed to answer is 9.5 seconds. So that's pretty good. So the VA is investing in prevention. So there's the Staff Sergeant Gordon Fox Suicide Prevention Grant Program, and 105 million have been allocated for this. There's public awareness and resource campaigns, which have reached over 7.9 million veterans. And this has driven over 3 million visitors to support the site va.gov/reach, which was the campaign from last year. So there's also the Governor's Challenge and Community Engagement. So this is offered in all 50 states and 5 territories. The VA has partnered with 1,700 community coalitions to engage veterans in crisis. And then the VA does do lethal means safety, and we've distributed more than 400,000 cable gun locks. So lethal means safety. So what does lethal means safety? In the context of suicide prevention, safe storage of lethal means is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. Effective lethal means safety education and counseling is collaborative and veteran-centered. It respects the important role that firearms and medications may play in veterans' lives, and is consistent with their values and priorities. So most suicidal crises are brief. Time from decision to action is less than 1 hour. So in one study of suicide attempt survivors, 24% said that it took less than 5 minutes between their decision to attempt suicide and their actual attempt. And so 48% said it took less than 20 minutes, and 71% said the decision was made within an hour. So building in time and space between the impulse to act and the means to harm oneself saves lives. While some suicidal crises last a long time, most last minutes to hours. The time between when a person decides to die by suicide and they act on the decision is very short. Building in time and space, even 30 to 60 minutes between impulse to act and the means to harm oneself saves lives. We know that people rarely substitute one means for another, so it is important to restrict whichever means they have in mind to use. Means matter. How a person attempts suicide impacts how fatal the injury will be. About 90% of firearm-related suicide attempts are fatal, as compared to approximately 5% of suicide attempts by all other mechanisms combined. Most who have survived a non-fatal suicide attempt do not go on to die by suicide. So lethal means safety works. Reducing access to lethal suicide methods is one of the few population level interventions that has been shown to decrease suicide rates. About 90% of people who survive a suicide attempt do not go on to die by suicide. If we can collaborate with veterans ahead of time to help them survive a suicidal crisis, we have likely prevented suicide for the rest of their lives. So firearm safety, simple actions help keep individuals and families safe. So no one can unfire a firearm. For someone in crisis, a locked firearm can mean the difference between a tragic outcome and a life saved. So the suicide prevention coordinators at local VA medical centers can provide gun locks to secure firearms in the home. And we do have a SWOCC table out front with gun locks. So if anybody is interested, please feel free and take one. So how to install cable lock into a firearm. So I'm not going to go into the details of all of these different guns, but I will point out that they do work on semi-automatic pistols, revolvers, modern sporting rifle, semi-automatic or pump, so an action shot firearms, and bolt action rifles. So firearm cable locks can provide critical life-saving moments between impulse and action. So make sure all firearms are unloaded before they are put away. And again, 85 to 90% of suicide attempts with firearms are fatal. Firearm locks can prevent a crisis from becoming fatal. So suicide is preventable. Don't believe me? Take it up with Metallica. So just a little more context. So last year, Metallica came out with a song about suicide. And so the VA wanted to partner with them, and that's how this came about. So we're gonna go over common myths versus realities now. So a common myth is people who talk about suicide are just seeking attention. The reality is, no matter how casually or jokingly said, suicide threats should never be ignored and may indicate serious suicidal feelings. Someone who talks about suicide provides others with an opportunity to intervene before suicidal behaviors occur. So another common myth is the only one who can really help someone who is suicidal is a mental health counselor or therapist. The reality is, special training is not required to safely raise the subject of suicide. Helping someone feel included and showing genuine heartfelt support can also make a big difference during a challenging time. So now we're going to go over the steps of VA SAVE. So VA SAVE is teaching communities how to help veterans at risk for suicide. So VA SAVE will help you act with care and compassion if you encounter a veteran who is in a suicidal crisis. So S stands for signs of suicidal thinking should be recognized. A stands for ask the most important question of all. V stands for validate the veteran's experience. E stands for encourage treatment and expedite getting help. So S stands for signs of suicidal thinking. So learn to recognize these warning signs: feelings of hopelessness, feeling like there is no way out, experiencing anxiety, agitation, sleeplessness, or mood swings, feeling like there is no reason to live, experiencing rage or anger, engaging in risky activities without thinking, increasing alcohol or drug use, withdrawing from family and friends. So that could look like just not responding to phone calls, text messages, or just not wanting to do anything, like just distancing themselves to probably hide their feelings. So the presence of any of the following signs requires immediate attention. So thinking about hurting or killing themselves, looking for ways to die, talking about death, dying, or suicide, engaging in self-destructive or risk-taking behavior, especially when it involves alcohol, drugs, or weapons. So know how to ask the most important question of all. Are you thinking about killing yourself? So we want to be as direct as possible. If we are indirect, we're going to get an indirect answer. So again, are you thinking about killing yourself? It may be uncomfortable, but being direct is the best way. So asking the question, do's. Do ask the question if you've identified warning signs or symptoms. Do ask the question in a natural way that flows with the conversation. Don't ask the question as though you are looking for a no answer. You aren't thinking of killing yourself, are you? And don't wait to ask the question when someone is halfway out the door or halfway off the phone. So if you know someone has a time limit, like they have to be somewhere, you don't want to wait till the last minute. You want to give time and space to be able to talk it through. Thank you for that. Perfect. So we want to use direct words and phrases such as killing yourself and suicide when asking about suicidal thoughts. Avoid using vague phrases such as hurting yourself, as these can have different meanings to different people. What may be the outcome of asking an indirect question? Again, getting an indirect answer. Ask the question if warning signs or invitations are evidence. When invitation statements have been made, it can be helpful to use them as springboards to directly ask about a person's risk for suicide. So an example would be, I want to better understand what you mean by ending it all. Are you thinking about killing yourself? Phrase questions in a way that indicates openness to listening and remain non-judgmental, no matter the answer. This is extremely important as it will help the veteran understand that people are willing to listen. There may not be an optimal time to ask the question, and doing so may be discomforting. So as asking the question, chicken and examples. What are your thoughts about asking the question?
I think the first thing I think about is, how do I do it? Is there ever the right time? Does it matter how I say it? Do I have to watch things like my tone? It makes me hesitant. And, you know, I wondered, like, how could I get more comfortable just bringing it up? What would a casual way to do it look
I don't think there is really a casual way. I think you just need to get ahead of it. You identify it, be very blunt, direct, like you said, maybe a little open, non-judgmental, but let them know you care. I mean, that's the biggest thing, because they're already going through, nobody cares. Nobody cares what you know until they know you care. And when you turn that around and you say, hey, are you thinking about killing yourself? You know, that's a permanent solution to a temporary problem. And then you just kind of build from there.
Yeah, thank you. I think another common fear that people have is if they ask a question and they say yes, how are you going to help them? And if they die by suicide, how would that feel for you? So there's the whole purpose of this is to teach people that there is help and support. So when someone does disclose that to you, you know what to do to get them help. So being confident with getting a yes, I am feeling suicidal, and then you know what to do next. Yeah. So I'm going to demonstrate a few ways of asking the question, both good and bad. So good ways is, do you want to kill yourself? Have you been thinking about suicide? Do you have a plan to kill yourself? So these are great ways because they're very direct. And some bad ways of asking the question, you don't want to kill yourself, do you? You wouldn't do anything stupid, would you? And suicide is a dumb idea. Surely you're not thinking about killing yourself. So these are shaming a person. We don't want to shame anybody for having these feelings. We are trying to normalize mental health. Mental health is becoming so more and more common nowadays, and we need to be kind to each other and be accepting of when we are having these feelings. So V, validate the veteran's experience. So talk openly about suicide, be willing to listen and allow the veterans to express their feelings. Recognize that the situation is serious. Do not pass judgment. Reassure the veteran that help is available. So validate the veteran's experience, examples, and check in. So example of validating statements would be, anyone in your situation would feel that way. Of course you're overwhelmed. You have been struggling with a lot, and this would be too much for anyone to handle. So we want to show empathy. Does anybody have any thoughts of these validating statements?
I just think sometimes it's really good to be able to reflect like that, because it helps the individual to ground and think and process. Whereas maybe before that, they had been just perseverating on one thing. This allows them to say, hey, somebody does care and I can come out of my box a little bit more and build some trust. Trust is such an important part.
I agree.
Definitely.
I think the trust there, that builds a relationship, saying it that way. Because you're validating their feelings. And then you go, yeah, I felt that way before, or anybody in that same position would feel the same way. Share. And then, in the Army, we had this whole thing with like getting into their OODA loop, observe, orientate, decide, and act. If you take one chain out of that whole link there, then they stop and they think. They can't just run the full circle. So basically, talking to them is slowing them down. It's making them think. So it's taking a link out of that chain, and they're going to have to listen to your words, and you're going to have to decide.
Yeah.
You're on their team or not, and that's the big thing right there.
Yeah, it sort of lets you know that they matter, right?
Exactly.
Thank you. So E, encourage treatment and expedite getting help. So what should I do if someone is suicidal? Don't keep the veteran's suicidal behavior a secret. So if someone says they will talk to you, but don't tell anyone, it is important to be upfront with them and say you cannot make that promise because you care about them and want them to get the help they need. You don't want to keep a secret and regret it. So you don't want to leave them alone. Try to get the person to seek immediate help from their doctor or the nearest hospital emergency room. Call 911. Reassure the veteran that help is available. Call the Veterans Crisis Line at 988 and press 1. So when talking with a veteran at risk for suicide, we want to remain calm, listen more than we speak, maintain eye contact, act with confidence, do not argue, use open body language. So I like to point out, like, don't be looking around the room, don't look on your phone, crossing your arms. You want to be comfortable and confident and let them feel that so they feel like they're in a safe space. Limit the questions, let the veteran do the talking. Use supportive, encouraging comments. Be honest, let the veteran know that there are no quick solutions, but help is available. So what to do if a veteran expresses suicidal ideation during a phone call? So keep the caller on the line, do not hang up or transfer, remain calm. Obtain identifying information on the caller, so get their name, phone number, and their current location. So conference call to the VCL, don't hang up until the VCL responder has the call. Enlist coworkers for assistance via instant messaging in Teams. So if this happens at where you work, just whatever way is the best way to get in touch with a teammate. If you're going to need further support, if they do hang up, or you're going to need to call 911, if there's no other time to get different support. So if the caller disconnects, call them back immediately. If they don't answer, dial 911, or you can call the VCL 988 and press 1. Anybody else, just call 988. So a tip is practice conference calling at your desk with coworkers. So knowing how to do a three-way call, so whether that's at work or on your cell phone, it's better to know ahead of time how to make that call rather than try to figure it out when you're in a crisis. Some people seem to escalate and can't think clearly when in a crisis. Some people slow down, so there's different types of personalities. But I would highly recommend knowing how to make a three-way call because you never know when you might be in that situation. So remember, VA S.A.V.E. So S stands for signs of suicidal thinking should be recognized. A stands for ask the most important question of all. V stands for validate the veteran's experience. And E stands for encourage treatment and expedite getting help. So resources and references. So if you're interested in more S.A.V.E. training, there is a free suicide prevention training video that is less than 25 minutes long and available to everyone 24/7. It's offered in collaboration with the Psych Armor Institute. And then there is the link on the bottom of this slide. So free confidential support 24/7, 365, the Veterans Crisis Line. So dial 988 and press 1. And again, this is the National Suicide Prevention Lifeline. So anybody can call this number, just veterans press 1. So veterans, service members, family members, and friends, that population would press 1. Anybody else, just call 988. So the Veterans Crisis Line was founded in 2007, and they launched the online chat in 2009. They launched the text line in 2011. They started the Caring Letters program in 2020, and they launched a peer support outreach center in 2021. And then in 2022, they came up with the 988 number. So as of January of this year, they've received more than 7.6 million calls received more than 910,000 chats, more than 360,000 texts, and more than 1.4 million referrals to the local VA suicide prevention coordinators. So typically, when we get a consult from the Veterans Crisis Line, it's usually when a veteran is in need of further services. And I would say my experience has been the number one consult connection that veterans are needing is mental health services. So that's what our team does for veterans. Another common one is needing resources for homeless resources, or getting connected to a primary care physician. So they've called the VA several times, they can't get through, or someone's already put a consult and they're waiting to get a response. So just whenever they're needing someone more locally to really advocate and get their needs met, that's when they are sent to the local suicide prevention team. And then they've had more than 313,000 dispatches of emergency services. So out of that 7.6 million calls, 313,000 dispatches of emergency services, so welfare checks. So find a local VA suicide prevention coordinator at the veteranscrisisline.net/resource locator. So there's more than 400 suicide prevention coordinators nationwide, and we provide direct care, monitoring and oversight, reporting and tracking, and outreach and education. So coaching into care, this is a resource for program. This is a program for families and loved ones of veterans, helping them encourage the veterans in their life to seek support. And there's the phone number listed there. So suicide risk management consultation program for providers who serve veterans. So why worry alone? The Suicide Risk Management Consultation Program provides free consultation for any provider, community, or VA who serves veterans at risk for suicide. So common consultation topics include risk assessment, conceptualization of suicide risk, lethal means safety counseling, strategies for how to engage veterans at high risk, best practices for documentation, and provider support after a suicide loss, so postvention. And you can initiate a consult by emailing SRM consults. So postvention resources, this is also from Merrick. They are a great resource. My team has actually used them a few times recently. So they, can you click it one more time, please? So they provide resources for community, providers, and workplace. So they have films, infographics, and podcasts. So practice safe storage of firearms, medication, and other lethal means. So you can visit keepitsecure.net to learn more about the importance of firearm and other lethal means safety. Nearly half of all veterans own a firearm, and most veteran firearm owners are dedicated to firearm safety. Firearm injuries in the home can be prevented by making sure firearms are unloaded, locked, and secured when not in use, with ammunition stored in a separate location. There are several effective ways to safely secure firearms. Learn more and find the option that works best for you and your family from the National Shooting Sports Foundation at nssf.org. So the VA does have a bunch of different mobile apps, and this is a great one. The safety plan is in the PTSD Coach app. So to access the safety plan, you download it and you tap on the safety plan. So this is a great resource that I always like pointing out. So instead of having a piece of paper that you can lose, you can have your safety plan on your phone. And just in case if people are wondering what is a safety plan, so the safety plan consists of 6 different steps. So it identifies signs that you should use your plan. So warning signs, ways you can cope on your own, social distractions. So when coping by yourself isn't working, what other resources can you get outside of yourself? Family and friends that you can call, your professionals in your life that you can call, and how can you keep yourself safe. So some other resources, so there's the local suicide prevention coordinators like myself. There's the Veterans Crisis Line, the Veterans Text Line, the Veterans website. And so for our catchment area, unfortunately, we only do have one vet center, and that is in Eugene. And as I had already mentioned, the VA does have several different mobile apps that promote health and wellness. And, and then a couple others that I like to point out, Vets for Warriors. So this is ran by veterans. So this is a great resource. Sometimes I'll talk to veterans and they say, you know, I'm not comfortable calling into VCL because I don't want to talk to anybody who's not a veteran. They don't understand what I'm going through. So this one is great. Vets for Warriors. And then postvention.org, I like to point out. So this is for services for after a suicide attempt or death by suicide. Excuse me. And then there's another app that I found out about. It's on apple.com. So this is another safety plan. So if you don't want to use the PTS coach, you just want to have an app that's strictly just a safety plan, that's a great resource. And then I put the county crisis lines for our catchment area. So Douglas County, Coos County, Curry County, Lane County, and Western Lane Fire and EMS. So the Roseburg VA Healthcare Suicide Prevention Team. So we have 3 suicide prevention coordinators. My teammates are Stacy and Todd, and they are based in Eugene. And we have our new community engagement and partnership coordinator. So it's a CEPC, William Wagner, which is here with us today. So we are very grateful for this new position and hoping that we will see a lot of more partnerships and outreach in our communities. So that's great news, and hopefully you'll be hearing more about the VA because of that. Does anybody have any questions about anything? Okay. Well, thank you again for your time. I know it's Friday night, so I appreciate that. And if anybody does have any questions, if they want to talk privately about or need any support about anything, my teammate Will and I will be here for a little bit. And again, there is the swag and the gun locks. So if you do want to take anything, please help yourself. Thank you.
Thank you.
Thank you.
Thanks, everybody, for coming. Oh, no, not what I'm gonna do there. And
This is why we have insurance.
this is going to be available on the college's YouTube channel permanently. So if you want to tell people that this is available, you know, that they could at least, you know, watch and get the information. You know, the more people we get the information out, the better.